All right. Hello, everyone. Dr. Mehryar here with you. I'm going to be speaking about keeping our lungs healthy. So, a real recap. I'm going to talk about our entire respiratory tract, okay, not just our lungs. And while doing so, I'm going to include some of the basic understandings about our lungs. Okay, and why is that? Is because I want you to understand what goes through our mind as doctors when we will give you certain type of advice. For example, if I'm telling someone to stop smoking, if I'm telling someone to take antibiotics or don't take antibiotics, I want you to understand what do we mean and why do we give such advice whenever applicable. So I'm going to include some of the basic things in our understanding of a healthy lung. So it would be easier for you to understand the topic and also in the future to be more interactive when you're receiving advice from your doctor. So, as we started, this is our respiratory tract. Okay, so our respiratory system is not just the lungs. Okay, so here we have the lungs. Okay, and it starts from our nasal cavity, which is here, which is our nose, and it will go up to the lungs. So anything up that happens in the upper part in the nasal cavity can ultimately affect our lungs, and anything that happens in your throat can end up affecting your lungs. So we need to look at this system as a whole, not as something separate. Okay, so our respiratory tract is usually divided into upper and lower. Okay, so here is usually where we draw the line. Okay, anything above is the upper and anything below is the lower respiratory system. So whenever you're having an infection, let's say something like influenza, okay, it usually starts in your nasal cavity. Okay, so influenza is going to be here. um, Something like COVID is going to be here. Okay, it will start in your nose, but you would see that during COVID, we would say that, someone is having severe cough, someone is having shortness of breath. Why is that? Because the COVID starts from the nasal cavity and it can go up to your lungs. Okay, your pharynx, which is your throat, okay, is going to also be affected. Okay, so the pharynx is usually when your mouth is. This is the mouth, okay, and it comes down to here, and this is your nose, and this is also a part of the pharynx. So it is very understandable. So when you have an infection like influenza or COVID in your nose, it can very easily come down and go to your throat and cause a sore throat as well. So having a sore throat does not mean that I have an infection in my throat. It could just be something that is coming from my nose and is affecting my throat. Okay. So this is usually what we call an upper respiratory tract infection. Okay. Um, so I'm just trying to lay down the basic understanding. The lower respiratory tract starts from the lower trachea, okay, which is your windpipe, okay, and also we have the bronchi. This part is the bronchi, which comes down, gets branched into your lungs, and of course, ultimately, you have the lungs, which are the basic unit which you breathe about. Okay, so we can have some basic pathologies that can be connected to the lungs, okay, and also to your nose and your throat, which I'm going to talk about, and then we're going to give you some basic understanding on what is important to know about these topics. So the very basic tips is about the air quality. Okay, we have two metrics. One of them is the indoor air quality and outdoor air quality. Okay, so why is this important? Because this is going to end up causing a lot of our major problem that are allergic in nature. Okay, so outdoor air quality, it's something that you most of the time don't have a control over. Okay, let's say dusty environment, someone who has asthma, someone who has allergy in his nose, which is allergic rhinitis, is going to be triggered if for example, the air is dusty, or something like uh, getting exposed to the pollens, to trees during springtime. Okay, so this is something that you don't have a control over. But what can be done is to try to avoid such environments. Okay, for example, someone who has asthma and knows that he's usually triggered with dust can potentially try to avoid outdoors when the weather is very dusty. Okay, and if there is no way to avoid it, then it would be a good idea, like this gentleman over here, to wear a mask. Okay, to try to avoid having this kind of allergens, which are the molecules that cause allergy, up in his nose and in his lungs. Okay, the second thing is indoor air quality. We have a lot of control over this one. Okay, so there are two things that in the environment like the UAE can affect the indoor air quality, and the first one is the air conditioning. Okay, so air conditionings are units that we have in our home which can have a lot of dust in it. Okay, especially um, during the winter time when it might not be used that often, it will accumulate a lot of dust. And once you switch it on, what happens is that all the dust gets spilled into the air in the room. Okay, and you will end up breathing that dust in. Okay, and that's going to cause a major problem for you. Okay, so what happens is also in many patients I have who have allergic rhinitis or who have something like asthma. Okay, once they clean their AC ducts, they will end up improving with symptoms. And you might see that, sometimes it is that people don't have any problems with their nose, don't have any problem with their asthma, and they complain that just when I wake up from sleep, I'm having these symptoms. It is because they are switching on their AC and they're sleeping. Okay, so during the sleep, all this dust and allergens are going to go inside their respiratory system and cause all kinds of problems. The second thing that we can deal about the indoor air quality is secondhand smoking. Okay, so if you are a smoker, of course you are polluting your indoor air quality. Okay, and you are also damaging your respiratory system, but you do also damage your family's respiratory system by polluting the indoor air quality, by decreasing the quality in the room. Okay, so it is important to know that not just smoking indoor is going to affect you, but is also going to affect anyone who lives with you in this under the same roof. Rhinitis. Okay, so this is the rhinitis means inflammation of your nose. Okay, so inflammation of your nose can have different causes. Okay, as we have already spoken about, viral infections can cause rhinitis. Allergies can cause rhinitis. Okay, allergy is going to be either due to, for example, pollens. Okay, or it can be due to um, environmental pollution. Okay, which we have already spoken about. Some people might get triggered with cold air. Okay, or something that we call hypothermia. And of course, the last one is going to be bacteria. Now, how do we differentiate this? Okay, so one of this based on symptoms. So one of the symptoms is sneezing. Okay, so sneezing is a normal reflex that we have in our body to clear any anything that has entered our nose. Okay, so if you have dust in your nose, your normal body reaction is to sneeze, because when you sneeze you will take that out by force from our respiratory system. So it makes sense that when you have a virus there, when you have a pollen there, when you have dirty air inside, you will start sneezing as an protective mechanism. Okay, So the two things that go hand in hand is nasal discharge and nasal congestion. Okay, this could happen again with any of this causes. Okay, one thing that makes a good difference for us, okay, is between viral infections, okay, and between bacteria. So what happens in bacteria is that this discharge is going to be thick, it's going to be yellowish, but in case of viral infections, it's going to be watery discharge. So this is a good distinguishing factor, okay, because most of the time, around 80% of the time, we are just dealing with viruses and we are not dealing with any type of bacteria. Lacrimation means watery eyes. Okay, so watery eyes, it again, it could be a symptom of either a viral infection, allergy, or a bacterial infection. Okay, so what happens is that your nose, okay, is connected through some ducts because the nasolacrimal duct to your eyes. Okay, so your eyes is going to be affected by whatever your nose is affected with. Okay, so they are connected. That is why, for example, when you cry, you will also get a runny nose because your eyes is connected to your nose. So if you have a virus in your nose, it can easily cause a viral infection in your eye. If you have an allergy in your nose, it can cause easily and the same kind of allergy in your eyes. Okay, so this is that something that we deal with. Uh, Again, we have also no smell. You might be familiar with this due to COVID, but any upper respiratory tract infection can end up giving you loss of smell. Why? Because the nerves that used for smelling are in your nose. So any inflammation that happens in your nose can damage that nerve and it can cause loss of smell. Now, most of the time, this is self-limiting. It means that it gets better by itself, okay? But it might take some time. Maybe for most people, within 1 week, it will come back, but it's unheard of for this condition to take several months to come back. Okay, so this should be it in general. Okay, I don't want to go into more details about the symptoms. Disease treatment. Okay, it could be antibiotics for some kind of bacterial infection. It could be anti-inflammatory pills. Okay, something for example like Brufen that we take. Okay, it could also be antihistamines, which is anti-allergy. Okay, we also that we give you something like Zyrtec, something like Telfast, which is usually used for allergy condition. But the main stray of treatment of allergies would be nasal sprays. Okay, so nasal sprays, usually steroids, is the first line treatment for allergy in your nose. Okay, uh, and also for some type of congestions that we have with viral infections, also we end up giving you some nasal sprays which are non-steroid to help you relieve the congestion. Very important note here that is this nasal sprays tend to cause a lot of problems. It has if they have been used more than 5 days. Okay, so the maximum usage should be 5 days because your nose will get used to it, and when you stop it, the problem is going to come back pretty faster. Okay. Antiviral drugs, okay, this is something that I'm going to talk about later on, but some viral infections like influenza, they have medications that are effective against influenza that can be offered to anyone who has a confirmed diagnosis of influenza. Of course, steaming and inhalations are some of the other techniques that might help you with this kind of problem. So influenza. So this is the main thing that we deal with every year. Okay, there will be influenza viruses going around, and during the winter times, a lot of people are going to get down with influenza. Okay, so symptoms could be they could vary very much. Okay, most people are going to have fever. Most people are going to feel cold. Most people are going to have muscle aches. So these are some general symptoms. Okay, also, headache is part of the general symptoms that you're going to have with influenza. Some people might end up having diarrhea and nausea. Okay, this is usually more common in children. You might not be having a lot of appetite, so you might be having a lot of boring foods. Sneezing and coughing is something that happens very frequently with influenza virus and with most of the viral infections. Okay, so this is one of the primary ways the virus is going to get itself transmitted to other people. Okay, so these viruses are smart. They're going to give you a certain type of symptoms, which is going to make it easier for them to go to the next person and infect others as well. So sore throat is also one of the things that we can have. As I explained, anything in your nose can end up going to your throat and cause a sore throat. That does not mean that you are having an infection primarily in your throat. Okay, it just could be sign of a viral infection. Trachea and lung pain. Okay, so this is very vague description, but you could have pain in your windpipe, and you could have affected in your lungs. That can be just a simple cough that you're having, or it could be a full-blown viral pneumonia that can cause and usually we see in extremes of age, which means very young people or very old people or people who are vulnerable to medical symptoms. Okay, so for what we call an upper respiratory tract infection, you rarely need antibiotics. Okay, so this is that something I'm dealing with on daily basis with patients. Uh, patients expect to be treated with antibiotics because that has been the norm with many physicians for many years. Okay, uh, data suggests that almost 82% of all the upper respiratory tract infections are viral. It means that if you don't do anything about them, if you don't take a single pill for its treatment, it's going to get better by itself within 5 to 7 days. So it's something self-limiting. It's something that your body's immune system will be able to take care of it. Okay. So do we, if we have this kind of infection, do we need antibiotics? Okay. And your answer is no. You are not going to need antibiotics. So something that happens very frequently is that patients go to a doctor. Okay. And they have been sick for 1 day and the doctor tells them you don't need antibiotics. Okay, so the patient does not take any antibiotics and it goes until day 4. They don't feel better because, as I said, the time frame is 5 to 7 days. They don't feel better, so they will go to another doctor, and this new doctor gives them antibiotics. Okay, they will take their antibiotics here. They will take their antibiotic tablet, and they will feel better on day 5 because the time frame is 5 to 7 days. And patients think that because of this antibiotic on day 4 that they have taken, now they have got better on day 5, which is not true, which is something that is going to hurt us on the long run. Okay. Same thing with cough. Most of the cases of cough, most of the conditions, even a bronchitis, is most probably viral. 81% of the time. Okay. So not antibiotic is needed. If you are going to need antibiotic, is in the cases that you are coughing a lot of sputum. Sometimes we ask you, is it a dry cough or is it a wet cough? Okay, so this is going to be the distinction. Most people are going to answer wet cough even if they're having a dry cough. Okay, because when you are coughing, you're going to cough up some sputum, some mucus anyway, because that is what's in your lungs. Okay, so no, with just a small amount of sputum, you would not need antibiotics. If there is some kind of a bacterial infection, there will be large amount of sputum. Okay, it's going to be so large that we measure it as a cup. Okay, it can fill up one cup. Okay, so this is the kind of a criteria when we're talking about a wet cough. Now, we have a medicine called oseltamivir. Okay, that's maybe known to many of you as Tamiflu. We use it for influenza. Is it good? And the answer is yes. When is it good? If it is started within 48 hours of your symptoms. Okay, how does it help you? It's going to shorten this duration. Okay, instead of 5 to 7 days, it might make it 3 to 4 days. It's going to shorten the duration. So it makes sense that it's almost useless if it's start after 48 hours of your symptoms appearing. Do everyone need to take this when they have influenza? And the answer is no. Can everyone take it? And the answer is yes. So how do we decide? Is first of all based on testing. Okay, so we need to test for influenza, confirm it is influenza, and then start the Tamiflu. Uh, the second way to do it is to see if the patients are at increased risk of complications from influenza. For example, very young children, those who are above the age of 65, those who have chronic medical conditions, those who have cancer, those who have severe diabetes, those who are immunocompromised. These people might benefit more from getting Tamiflu than other people. So one more use for this medicine is for prophylaxis. Prophylaxis means preventing influenza. So if, for example, a family of four, one of them is diagnosed with influenza, this DIN medication can be taken by all the family members, okay? But in a smaller dose to prevent influenza, and that has been shown to improve and reduce the chances of them getting influenza. So, good thing about influenza is that we have a vaccine for it, okay? And the bad thing about the vaccine is that we are going to do it annually. Every year it needs to be taken. Why is that? Is because the influenza virus changes very rapidly over time. Okay, you might have seen with COVID that every few months we had a new strain of COVID. We had the virus has evolved into something different. Okay, and that the vaccines that we took might not be as effective as for the new strain. So same thing happens with the influenza vaccine, but because of the nature of the virus, is going to happen very more often. Okay, so these vaccines are going to be offered every year between September to November. Okay, so the earlier we take it, it's going to be the better. Okay, so this is usually we recommend it for everyone to take. Okay, especially those above age of 65, pregnant women. It's safe to take it. It's going to protect them from severe infection, healthcare workers, children going to school, getting mixed up with other children. So everyone can take this. Okay. So there are some myths about the influenza vaccine, which is most of them are, something that might not have any scientific reason. Okay, and some of them might not be even applicable. So I would suggest that if you want to get the vaccine, to get a consultation with your doctor done to see if it is a good idea for you to get the vaccine or no. Okay, so the vaccine can prevent flu. Okay, the vaccine cannot give you flu because it is inactivated. It's a killed virus. Okay, it cannot give you the flu, the vaccine itself. Okay, um, so you can get the vaccine anytime. Okay, it will take around 2 weeks for the antibodies to develop. So you have to take the vaccine as soon as possible, which is around September once it becomes available. And the flu shot is not going to protect you from all of the flu viruses. Usually, what we have is in one given year, we have 100 different types of influenza viruses. Okay, but 80% of the influenza infections are going to be caused by four different type of strains. Okay, so these four strains will cause 80% of all the influenza infections. So the vaccine is usually going to be against these four strains. So you still can get flu through different other strains, but we have tried to give you more protection by, you know, try to give you, uh, try to give you immunity against the most common types. Okay, as it's written here as the explanation. I never get the flu I do not need the flu shot. So this is another myth because you can be getting it, and everyone can be getting it. And once you get it, you can easily pass it on to other people. Again, influenza for young, healthy people might not be a big deal, but this might be a big deal when it comes to those who are vulnerable, elderly, those who have chronic diseases. It's going to affect them much. So, influenza can be prevented, as we have already said, by vaccine. The vaccine must be taken annually. So, the vaccine that you have taken in 2022 will not be effective in 2023. And this is, as I mentioned, is because the virus is changing on a constant basis. Best time to take the vaccine, as I said, is September and November. So your best bet is to around September try to inquire about the vaccine. Is it available? Is there any changes? You can speak to your doctor. You can speak to your primary healthcare provider. And for those of you in the UAE, this is usually offered in government hospitals, and sometimes it could be free of charge with no additional cost from the residents in the country. One thing I wanted to talk about when we talked about throat infection, okay? So many times you see that when you come to the clinic, we try to look into your throat to see what is happening, okay? That is important because that's going to give us an understanding, okay? So this is what I want you to understand, okay? Bacterial infection versus viral infection. When we give teleconsultation, unfortunately, we will not be able to visualize your tonsils. Okay, so what I usually ask the patients is to do it themselves, to look at the tonsils and tell me what do they see. So when we want to start an antibiotic, okay, we are looking for this kind of a picture. Okay, these are pus, the whitish spots here is pus. Okay, red swollen tonsils can be seen in both viral infections and both in bacterial infections. Okay, throat redness is going to be seen both in viral infections and in bacterial infections. So this whitish or yellowish spots is unique to bacterial infection. The gray discoloration of the tongue is going to be unique to bacterial infection, and the swollen uvula. Uvula is this hanging thing here, is also going to be an indicator of a bacterial infection. Okay, so this is very important, especially for those of you who have children. Okay, because you can easily try to visualize the tonsils and to have an understanding, is your child having a viral infection or a bacterial infection? Okay, that is going to give you a clue onto what you are dealing with. Now, we finished uh, talking about the upper respiratory system. Okay, so I think now we are going to go to the lower respiratory system, which are your lungs. Okay, it also contains your trachea, your windpipe, okay, and your bronchus here. So, how do we keep it healthy? So basically, one thing that we can all agree about is that it's going to be smoking cessation. Okay, to stop smoking, you can keep your lungs healthy, period. Okay, so this is the most important thing. I might have as well made all this presentation about smoking, okay, because that is the main thing that's going to deal damage to your lung. Here, as you can see, a non-smoker's lung and a smoker's lung, okay, and this is not some science fiction picture. This is very real. Okay, so this is how this happens, and this is going to affect your lungs in the long term. Now, how does it affect it? Okay, in the long term, and I'm going to talk about this in a little bit of detail here. Okay, so what happens is that this is your respiratory system. Okay, sorry for the bad drawing, but usually what happens is that this respiratory tract of yours is covered with cells like anywhere else in your body. Okay, and here we are going to have something on the cell that's called cilia. Okay, something that's called cilia. This is like your eyelashes on. Okay, so how do these things work is that when a virus, when a bacteria, when dust, when anything comes into your respiratory system, it gets stuck to the cilia. Okay, and what do? They move like hair. Okay, like a swimming piece of hair that it's going to trap this and it's going to send them back up away from your lungs. Okay, so this is what normally happens, is we call it ciliary motion. They will trap bacteria, virus, dust, irritants, and they will take it outside of your respiratory system. What happens with smoking is that the smoking is going to destroy these. Okay, so now in your respiratory system, you're not having this. So anything that enters your respiratory system is going to go down. Okay, it's going to go down directly up to your down to your lung. Okay, so this has something that happens very frequently. What happened to my mouse? Okay. So one more thing that happens with the lungs and smoking is that it's going to cause chronic inflammation. Okay, and again, I want you to make a basic understanding. So if this is your windpipe and it's coming down, it goes into your lungs. Okay, and it becomes your this is your lung, let's say. Okay, and it will give a lot of branches. At the end of these branches, we have something that's called an alveoli. Okay, it's something like this. Okay, something like this. At the end of this, you might have thousands of this in your lungs. So what happens is when you breathe, it goes to the end of your lungs. Okay, this is much like a balloon. Okay, what happens when you're breathing in? It's going to expand like a balloon, and when you're breathing out, it's going to become like this. So what does smoking do? It's going to cause inflammation in this part. Okay, is going to cause small amount of inflammation. And what happens with inflammation? Okay, if this is your skin and you get a cut here, okay, what happens through time? In a week or two, this cut is going to be fixed, and it's going to be replaced by what? By a scar. Okay, so there will be a scar here. The same thing happens in your lung. When you are smoking, you are destroying the cilia, and you are letting all of this dirt to go inside your lungs and cause inflammation. And this inflammation, when it's getting better by forming a scar. And now imagine doing this for 30 years, for 35 years. By your 50s, by your 60s, there will be no more of this left. It will be all replaced with scar tissue, and that is what we call COPD, chronic obstructive pulmonary disease. Okay, so I laid down the basis so you have an understanding that when we say stop smoking, why are we saying uh, to do that? Smoking leads to 8 million deaths per year, and 1.2 million of those are non-smokers, or those who are just having secondhand smoke. This is a very significant number that we need to pay attention to. So smoking is the leading cause of cancer. All of these things that I spoke about are, for example, ways of smoking leading you to chronic lung disease and to pneumonia, but also cancer. Smoking is the leading cause of lung cancer. Okay, but that's not it. It's a leading cause of the cancer in your throat, also in your mouth. Okay, also in your larynx, which is your voice box. Okay, so these are also some things to be taken care of. Smoking is the leading cause of bladder cancer. Okay, bladder cancer almost always exclusively happens in smokers. Okay, uh, smoking can cause other things like cancer in your esophagus. Okay, cancer in your kidney, cancer in the colon, cancer in the stomach, cancer in the pancreas. So part of the reason is that smoking usually comes with other type of habits. Okay, for example, drinking alcohol. Usually, drinking alcohol and smoking goes hand in hand. Okay, so we this is something that we call that the smoking is encouraging the alcohol intake, and the alcohol intake is encouraging the smoking. That's why cancers like esophagus, like pancreas, is also linked with smoking and with alcohol as well. So by stopping smoking, okay, which is the right thing to do, you're going to reduce your chance of being um, getting this type of nasty cancers in your body. Effects on quitting smoking is going to be enormous. Okay, so this is from WHO. Okay, and it's going to give you the effects that you will get on your body. Okay, the risk of a stroke is going to be reduced. Okay, because smoking can cause a variation in your blood pressure, and this is, can cause stroke. So the risk of a stroke decreases after 5 to 15 years. So this is a significant amount of time. Your heart rate and blood pressure is going to improve almost immediately, but the risk of the heart disease is going to drop after 1 year of quitting. Okay, your carbon monoxide level in your blood drops around 12 hours. Okay, so carbon monoxide is what kills you in a fire. When most of the people who are trapped in a fire, they don't die of burn, they die of carbon monoxide poisoning. So cigarettes have carbon monoxide in them. You're ingesting carbon monoxide with every cigarette. And if you look at cigarette packets, it will tell you the contents of its carbon monoxide. And the higher it is, the more dangerous it's going to be. Uh, Risk of coronary heart disease, that's a person who has never smoked. You're going to achieve this in 15 years from the time that you quit. Okay, lung cancer and all type of cancers like in mouth, like in throat and esophagus and bladder, 10 years. So again, this is significant. Circulation improves and lung function increases. This is pretty fast. Okay, 2 to 12 weeks, you're going to have a healthier lung. Okay, and of course, coughing, shortness of breath is going to be 1 to 9 months, but this is might be irreversible at one stage. Okay, once you develop, as I said, something that's called COPD, which has caused permanent damage to your lungs, it's often irreversible. So better to quit smoking before we reach to this spot. Okay, how can we quit smoking? Medications are available. Okay, different type of medications are available to help us. There are nicotine replacement therapies and there are medications that decrease the craving. So if you are interested in quitting smoking, you might have a couple of options to do that. How to best know which option fits you best is to speak to your doctor, because this can be individualized. Okay, so any person can have an individual plan on how to quit smoking. Okay, people usually tend to reduce smoking little by little, but most of the research suggests that stopping at once might be the best course of action rather than decreasing it over time. Avoiding triggers. Okay, avoiding triggers is going to be um, one of the important things if you want to quit. Okay, triggers can be for example, drinking. Okay, some people don't smoke, but they do smoke when they start drinking alcohol. Okay, so this is one kind of a trigger. Okay, another trigger might be hanging out in a place that everyone is smoking. You will end up smoking with them. Okay, or you might be end up getting secondhand smoking. So avoiding triggers is going to be important. Seek professional help. Now many clinics, many doctors, many hospitals offer you help if you want to quit smoking, to tell you how it can be done on individualized basis. Okay, you are different than me. I'm different than the guy next to me. So everyone's plan is going to be different. There is not universal plan for everyone for this, because everyone smokes for different reasons. Everyone has different duration of smoking, and everyone has a different background, medical background that needs to be taken into account. Exercise is what's again something that's going to help a lot. Okay, exercise, healthy food. This is something that's going to help your body balance out while you are trying to quit smoking. And remind yourself of benefits. Okay, remind yourself of the benefit that you will give to yourself, to your family, to your body. Okay, to your pocket. Cigarettes are going to cost a lot of A lot of money. Actually, you might look at it and on a daily basis, I'm smoking one pack a day, and that's costing me 15 dirhams. But try to calculate how much it would have been in 10 years period. It would have been a large amount of money. So it's a good thing to remind yourself of those benefits and try to motivate yourself. Now, um, this is one of the last topics that I want to talk about is to prevent pneumonia. Okay, so we have spoken already about cancer, okay, and about COPD. These are the two major causes of disease, of morbidity and mortality, of death from lung disease. Okay, cancer and COPD. So for cancer, we are dealing with, for example, we have different type of lung cancers. Okay, that the main cause of them is smoking. Can non-smokers get cancer? Yes, they can. And that something happens. Some type of cancers are more common in non-smokers than other in smokers. Okay, and can we prevent it? Yes, we can prevent it by try to reducing exposure to cigarettes. Okay. Can we screen for it for lung cancer? Yes. Okay. Those above age of 55 who have smoked ever. Okay, not an active smoker. Those above age of 65, sorry, 55 who has smoked can get a low dose CT scan to screen for lung cancer. Okay, so those above age of 55 can who have ever smoked can get a low dose CT scan of the chest as an screening method for lung cancer. Okay, so this is something that I wanted to put out there. For COPD, as we said, okay, the reducing smoking is going to be the major way of challenging COPD. Okay, COPD is it's in a spectrum of different disorders. Okay, it could be something like bronchiectasis, that, as I explained in the earlier slides, scarring of your lungs, emphysema, chronic bronchitis, all of these are going to come under COPD. Okay, unfortunately, most of them irreversible, means when you got it, it's going to be with you with the rest of your life. Okay, and you might need to have oxygen therapy on daily basis. Okay, this usually happens with longer period of smoking. Okay, it's going to cause this. Some people might get this due to genetic disease, which is it's not something that you can prevent, but for most people it's going to be caused by smoking, and it's a good idea to try to avoid it. Now, with this out of the way, these are the more serious things that can kill you immediately. We can go to something like pneumonia. So what is pneumonia? It's an infection in your lungs. Okay, so the infection in your lungs can be due to different causes. Okay, it can be due to virus, it can be due to bacteria, it can be due to different type of bacteria. Okay, it can be due to something like a pneumococcal bacteria, which is the most common bacteria to cause pneumonia, and it could be something like a fungus, which doesn't usually happen in healthy people. It could be due to something like tuberculosis, which is also bacteria. But for our discussion, we're going to concentrate on the bacteria type. Why? Because we are our topic is keeping the lungs healthy, and this is something that is preventable. Viruses, fungi, these things might not be preventable, okay? But the bacterial pneumonia is very much preventable nowadays by a pneumococcal vaccine, okay? So pneumococcus is a bacteria that most commonly causes pneumonia, okay? This is the most common bacteria to cause it. And the good thing about it, the vaccine for it is available. Okay, so the CDC, the Center of Disease Control in the United States, gives us recommendation on who should get pneumococcal vaccines. Okay, all adults above the age of 65 gets to get the vaccine. Okay, this is because the elderly are more prone to get severe pneumonia that's going to be life threatening. Okay, people who are 2 years old until 64 years old also can get the vaccine if they are immunocompromised, if their immune system is not working, if they have a splenectomy done. Okay, many people might have undergone a procedure to remove their spleens. Okay, this could be someone who has thalassemia, someone who has sickle cell disease, or it could be someone who was involved in a car accident and they had to remove his spleen because it was bleeding. Okay, so what happens is that these bacteria usually are having a coat around them. Okay, and this coat in healthy people is removed by the spleen, so it will expose the bacteria to be eliminated easily but by our immune system. But if someone does not have a spleen, then our immune system cannot get to the bacteria. So it's going to cause us a lot of problem. So what happens in the pneumococcal vaccine is that we give you injections that contains the antigens, the proteins that are on this capsule, and this is going to increase your immunity to eliminate this bacteria whenever it comes around. Okay, so adults who are between 19 to 64 who smoke cigarettes all also eligible to get the pneumococcal vaccine. So this is something important because pneumonias are common. Okay, and most healthy people are going to get just antibiotics tablets and they go home. Okay, so this is an uncomplicated pneumonia. But those who are vulnerable, those who are very young, those who are above 65 are at risk of developing severe pneumonia that needs inpatient treatment, that needs to be patient needs to be admitted to the hospital. And while admitted to the hospital, it's going to cause a lot of other problems that comes with admission to the hospital, getting exposed to secondary infections, getting exposed to immobility, which is going to cause a lot of problems. And it can be easily avoidable by taking the vaccine. So I am done with discussing an overview on all of these topics, and I would take questions now. In case any point in my PowerPoint presentation, in my speech, you had any questions about any of the points, I am happy to expand it to you or to try to explain it again. So I would take questions now.
Thank you, Doctor, for the insightful session. So we have a question that putting mask safe for respiratory system, as the mask prevent ingress from outside. Will it not also prevent exhaled gases from leaving freely? Will it not create a back pressure to our respiratory system?
All right, thank you for your question. And the answer is no. Okay, so gases usually pass freely through the mask. Okay, the masks are designed, there are different type of masks. Okay, but they are designed to leave small particles like viruses and bacteria away from you, but they will not generally cause any problem with the gases. Okay, by gases I mean what you breathe in, oxygen, and what you breathe out, carbon dioxide. It's not going to cause any problem with the normal gases, even with the more um, serious type of mask that we use at hospitals in for infections disease patients like N95. Still they would not cause any problem. So wearing a mask is safe, is effective. Okay, especially if you are dealing with people who are sick. If you yourself are having a flu, you can wear your mask. It's going to help. It's not going to completely prevent you from giving it to others, but it's going to help a great deal in reducing this. Okay, as an example, I would say that once when we had during the COVID pandemic. Okay, how many times did you get influenza? I, for myself, I'm a doctor. I During the COVID pandemic, I did not get influenza. I did not get any respiratory infection, and I was dealing with patients. None, because everyone was wearing masks. So definitely, it's effective and it's safe to use.
Thank you, Doctor. So there's one. There are two questions related to e-cigarettes and shisha, which are non-tobacco ones. Is it the non-tobacco ones safer than tobacco ones? And e-cigarette is the e-cigarette less than the normal cigarette?
All right. I wanted to actually point out this during my slides. Thank you for reminding me. No, all of them are going to be harmful. Okay. So what I told you in the slides, okay, that we have cells on our respiratory system that have a small projections called cilia. Any type of smoke can destroy this. So it doesn't matter if it's e-cigarettes, if it's vape, if it's shisha, if it's cigarette, all of them are going to do the same thing. Now, the difference is that some of this might not include a lot of carcinogens that might be there in traditional cigarettes. Okay, it might not have some ingredients like tar, for example, that can be an irritant to your lungs. Okay, but in the long term, okay, they are going to cause the same kind of problems that every other type of smoking is going to cause because they are what they are doing are destroying the cilia, and in your lungs, okay, at the end part of your lungs, they are going to cause inflammation over time, scarring over time, and you will end up with something like COPD eventually. So all of them, for our purpose, are doing the same thing, damaging your lungs.
Thank you. We have another question that is flu vaccine available for all age groups, including kids?
Yes. Yes, flu vaccine is available for everyone, including pregnant women. Okay,
Mhm.
because it's important because pregnant women can get influenza, and it tends to be it tends to be more severe. Okay, because of the condition of body physiology during pregnancy. And the good thing is that once they take it and they develop antibodies to influenza, they can pass on these antibodies to their children. Okay, so the child will give a relative protection for the first 6 months of life. Okay, so yeah, it can be taken in any age group and it's going to be beneficial for everyone.
Okay, so thank you. There's one question regarding passive smoking. When it is required to check medically for prevention.
Prevention of what?
So regarding passive smoking, when one should one can get checked for like how is the lung health of that person?
Usually, we don't recommend screening for any particular reason in this case. Okay, so screening tests should give you two important things. Okay, there should have something that am I looking for, and second, what the thing that I'm looking for, is it treatable or no? Okay, so if the answer to any of these questions is negative, then there is no need for a screening, because if I'm got some lung damage, okay, minor lung damage from secondhand smoking, and I do some extensive workup and will end up showing that yes, 10% of my lungs are scarred, what can I do about it? Nothing. There is no treatment for it. So the screening test for this purpose does not make any obvious sense.
Okay, thank you. So we'll take a couple of more questions since we are running out of time. So another question is, does asthma make your lungs weak?
Yes, asthma makes your lungs weak. In what sense is that again? I'm going to do a bad drawing for this one as well. I have my lungs here. Okay, I have my trachea, and let's say these are your two lungs. Okay, what happens in your lung is that you normally have mucus. Okay, you normally have some mucus in your lung, which healthy lungs do have. Okay, what does this mucus do? It will trap every kind of bacteria, every kind of virus, every kind of dust that comes in. Okay, and when they get accumulated here, you will start coughing, and this mucus comes out. This is how a wet cough is. Okay, so you're coughing up the mucus that is mixed with dirt, with bacteria, with viruses. What happens in asthma is that this mucus is going to increase a lot. Okay, so the amount of this mucus has increased so much that now it's causing wheezing. Okay, when you're breathing, because this this pathways has become so narrow that when you breathe, you're going to have a sound like this because the air is going through a narrow space. Okay, so yeah, can it affect your lung in the long term? Yes, because it's going to, this layer of mucus is going to trap all of this dirt as a normal lung does. But now you cannot take all of them out. It's, they are just keep accumulating in your lungs. So over time, yes, they can cause infection, over infection, over infection, which can damage your lungs.
Thank you. So we'll take one more question. So this question is from Sandra. She lost her mother from lung cancer in 22, and her question is that I'm 44 year old now, and I remember my childhood that my mom always smokes. Is there a preventive measure? Is there preventive measures that I could take so I will not get lung cancer?
All right, Sandra. First of all, I'm sorry to hear that. Regarding your question, preventive measures, it would be to avoid smoking. Okay, that is the number one and the most important thing that we can say. Most of lung cancers are not hereditary. They are not. Most of them don't have genetic basis. Okay, so again, there are no preventive measures that would be advised, unless, as I said, those who are smokers, who have been smokers, who have ever smoked, would get a one-time check above age of 55 with a low dose CT scan to just make sure that there is no kind of pathologies happening in the lungs. Uh, could lung cancers be inherited, be genetic? Yes, it could. In rare causes of lung cancer, it could be something systemic. Okay, some a part of other kind of a systemic disease. Okay, it depends on the different types of cancer. Okay, that could happen like that. But in general, the answer is the only thing that you can do is to try to avoid the smoking.
Thank you so much, doctor. And since we're running out of time now, I request you to please email all your questions regarding this. So if we move on to the next slide, doctor, we can see that there's a QR code which you can scan and download the TruDoc app. It's available on Google Play, App Store, and Huawei App Gallery. Feel free to download the app and reach out to us anytime for any queries which you have. And thanks again for joining, and have a nice day.
Thank you everyone for joining us and hope to see you soon for the next webinars, not as patients, as participants.
Yes. Thank you, everyone. Bye.